Hello and welcome to Everyday Health Stories by Dr. Koda Reddy, where we dive into intriguing medical cases and everyday health dilemmas to uncover valuable lessons. Today we have a fascinating story that contrasts the health of laborers and office workers, particularly focusing on the impact of posture and screen time on our cervical spine health. Stay tuned as we uncover this compelling narrative and then delve into the lessons we can all learn from it. One day, there was a segment on TV showcasing laborers in India. These laborers, known for carrying heavy loads on their heads daily, underwent x-rays of their cervical spines. The results were astonishing. Despite their strenuous physical activity, their x-rays showed no signs of damage. This finding was particularly surprising given the nature of their work, which involves lifting and carrying substantial weights over extended periods. In stark contrast, the segment also featured a group of accountants. These individuals spent 8 to 10 hours a day working at desks, performing sedentary tasks typical of office work. When their cervical spines were x-rayed, the results were dramatically different. The accountants showed severe degenerative changes in their cervical spines. This degeneration was evident despite the lack of physical strain compared to the laborers. This stark difference raises a crucial question. Why did the laborers who physically exert themselves daily show no signs of spinal damage, while the accountants who perform mostly sedentary work displayed significant spinal deterioration? The key lies in understanding the impact of posture and the nature of physical activity on spinal health. Laborers often carry loads on their heads, which naturally encourages them to maintain a straight posture. This alignment distributes the weight evenly along the spine, reducing strain and preventing damage. Conversely, office workers tend to lean forward while working at desks, a posture that places increased pressure on the cervical spine. Over time, this forward-leaning position can lead to degenerative changes and significant spinal issues. Next, let's talk about a lady who visited the office complaining of pain in her left arm. She had seen a neurologist and was prescribed gabapentin to manage her symptoms of dizziness and tingling. Gabapentin is commonly used to treat neuropathy, which is nerve damage. Further examination revealed that her C5, C6, and C6, C7 discs were damaged and protruding, compressing the nerve and causing her pain. This case exemplifies how poor posture and prolonged periods of looking down at devices can lead to serious health issues, including nerve damage and degenerative changes in the cervical spine. A video demonstrated the impact of head position on the cervical spine. When the head is held straight with the ears level with the shoulders, it weighs about 12 pounds. However, for every inch the head moves forward, the effective weight on the cervical spine increases. At 1 inch forward, the head weighs 22 pounds at 2 inches. It weighs 32 pounds. And at 3 inches, it weighs 42 pounds. This significant increase in weight places immense pressure on the cervical spine, particularly on the C5, C6, and C6, C7 vertebrae. Over time, this can lead to degenerative changes, disc damage, and nerve compression, resulting in pain, discomfort, and loss of sensation. In summary, laborers maintained a straight cervical spine while working, preventing damage. Accountants, on the other hand, frequently lean their heads forward while working, resulting in severe spinal changes. The lady with neuropathy in her arm likely experienced nerve damage due to poor posture, such as bending her head forward while using her phone. On average, smartphone users in the US spend about 3 hours and 39 minutes per day on their phones, and total screen time across all devices can average up to 7 hours and 3 minutes daily. This extensive screen use, often involving poor posture, places enormous pressure on the cervical spine and transfers stress to the thoracic spine, leading to chronic upper back pain and nerve-related arm pain. That was quite a story, wasn't it? Now, let's break down what we can learn from these fascinating observations and explore the science behind the impact of posture and screen time on our spinal health. First, let's discuss why posture plays such a crucial role in spinal health. When we maintain a straight posture, the weight of our head is evenly distributed along the spine. This reduces strain and helps prevent degenerative changes. On the other hand, when we lean forward, especially for prolonged periods, the weight of our head increases dramatically. This additional weight places immense pressure on the cervical spine, leading to strain, discomfort, and eventually degenerative changes. This is what we saw with the accountants in our story. Their forward-leaning posture while working at desks caused severe spinal issues over time. So, what can we do to maintain good posture and protect our spine? Here are some practical tips. Number 1, use the L test. Imagine forming a 90-degree angle with your thumb and forefinger. Hold your thumb against your sternal notch or the base of your neck and let your chin rest on your forefinger. This ensures your head is held at the correct level. Number 2, align your ears with your shoulders. Keep your ears aligned with your shoulders to maintain a straight spine. Avoid tilting your head forward or backward. Number 3, take frequent breaks. Stand up, stretch, and move around every 30 minutes to an hour. This helps reduce the strain on your spine. Number 4, ergonomic workstation. Ensure your screen is at eye level to avoid tilting your head forward. This can be achieved by adjusting your chair or using a stand for your laptop. Number 5, strengthening exercises. Incorporate exercises that strengthen your neck and back muscles. This can improve your posture and reduce the risk of spinal issues. And number 6, mindfulness. Be mindful of your posture throughout the day, especially when using devices. Make a conscious effort to sit up straight and avoid slouching. Next, let's talk about screen time. On average, smartphone users in the US spend about 3 hours and 39 minutes per day on their phones. Total screen time across all devices can average up to 7 hours and 3 minutes daily. This extensive screen use often involves poor posture, such as bending the head forward. This posture not only places pressure on the cervical spine, but also transfers stress to the thoracic spine, leading to chronic upper back pain and nerve-related arm pain. To balance screen time and maintain spinal health, consider the following tips. Number 1, use ergonomic tools. Invest in ergonomic tools such as a stand for your laptop or an adjustable chair that supports good posture. Number 2, set screen time limits. Be mindful of the time you spend on screens and set limits. Use apps that remind you to take breaks. Number 3, eye-level screens. Keep your screens at eye level to avoid tilting your head forward. This simple adjustment can make a big difference. And number 4, stretch regularly. Incorporate stretching exercises into your daily routine to alleviate the strain caused by prolonged screen use. In conclusion, the story of laborers and office workers underscores the importance of good posture and the detrimental effects of prolonged poor posture and extensive screen time. By making small changes in our daily habits and being mindful of our posture, we can significantly improve our spinal health and overall well-being. Thank you for joining us today on Everyday Health Stories by Dr. Koda Reddy. Stay tuned for more episodes where we explore more health topics and share stories that transform lives, one microhabit at a time. Remember, your health story matters. Until next time, stay healthy and keep your spine in line. Coming up in our next episode of Everyday Health Stories by Dr. Koda Reddy, we unravel a gripping tale that underscores the silent but deadly consequences of uncontrolled blood pressure. Meet Grandma Alice, a remarkable 95-year-old known for her indomitable spirit and daily walks. But one bright morning, her world spins out of control, and a seemingly ordinary day turns into a race against time. What caused her sudden collapse? How did a minor incident escalate into a life-threatening emergency? And what critical lessons can we learn from her story? Join us as we delve into the harrowing journey of Grandma Alice, uncovering the hidden dangers of high blood pressure and the importance of proactive healthcare. Her story is a wake-up call you won't want to miss. Tune in next time for The Price of Uncontrolled Blood Pressure, a lesson from Grandma's fall, only on Everyday Health Stories by Dr. Coda Reddy. Because sometimes understanding the small details can make all the difference. Stay tuned, stay healthy, and stay informed.